are now listening to Extracting Wisdom. Here to help you prevent the decay of your future is your host, Brandon Evert.
Hey everybody, thanks for tuning in to another episode of Extracting Wisdom. My name is Brandon Evert. We are live here at the Voices of Dentistry 2020, Day 2, as we kind of wrap up the conference for the weekend. Joining me on this episode, we have a fellow D2 from Texas A&M, right?
You got it.
Payton Keller.
Yep.
Welcome to the show, man.
Thank you so much. I appreciate you having me on.
Absolutely.
It's so fun to just kind of get into this world of podcasting, just to be able to experience and meet all the people that you hear, on podcasts, but you actually get to meet their face too. So
right,
it's cool.
Yeah, we've been talking about that all weekend. You hear all these voices from somewhere, and you know you've heard that person before, but it's nice to finally put a face to a name.
Yeah, absolutely.
So you are D2, Texas A&M.
Yep.
What's your schedule look like right now? What are you guys doing?
So it's kind of weird. So our school just started doing a new curriculum, and it was the year after I joined the school.
Okay.
So the D1s right now have a completely different curriculum than we have. It's definitely interesting because we can't really help them. Like they start clinical stuff a lot earlier than we did.
Got it.
And they're kind of trying to blend a lot of the classes together that might kind of overlap and teach the same thing in a different way. But yeah, so right now I'm a D2. We definitely have a lot of time in the sim lab, so drilling on plastic teeth.
Oh yeah.
Doing crown preps. So we have fixed prosthodontics, which is crown preps,
Yep.
bridges, all that kind of stuff. We have removable, so dentures, all that kind of stuff. And lab and lecture associated with each of those.
Mm-hmm.
We have oral pathology, which is just a lecture. Right. Which
is really dry usually.
Yeah, oh my gosh.
And the lectures are really long.
The teachers fly through all this stuff. And
oh yeah, same with us.
You're in class, all right, it's pretty much all in the PowerPoint, I got this. But then when you go back and have to listen to 3 or 4 150 slide PowerPoints to study for the test, you're like, oh my gosh, where'd all this come from?
I know. It really sneaks up on you. But it's hard to get through that much material. They have to present all of that within, a 2 or 3 hour span, and it's just so much.
Yeah, exactly.
It's a lot of outside class time dedicated to studying all of that. But yeah, those are tough lectures to get through.
Yeah. So we have that. So right now we're also taking endo. So we have class and lecture associated with that.
Right. So what does your clinical side of that look like?
So the clinical side is we're in the sim lab.
Sim lab, yep.
They give us
teeth.
So we haven't done actual extracted teeth yet. They give us plastic teeth with a simulated
canal.
pull.
Yeah.
To start off with.
Okay.
And we practice access, opening up the canal, that kind of stuff. I believe actually next week. So next week we're starting to do real teeth.
Perfect.
Just some extracted teeth and checking those out. But yeah, so we just started that a couple weeks ago. So
Okay.
don't have a whole lot of experience with that.
Okay.
But it's interesting because it's kind of like the whole first year of dental school. It's a bunch of stuff you haven't learned before.
Right.
So it's nice to kind of feel this is something that I didn't know before that I'll be good at now.
And we just went through that. We just finished our endo last semester, and it's difficult, especially you never know, especially with exams with brittle teeth and everything they could snap at any point, during an exam, which happened to me, which is unfortunate.
No,
but
that's terrible.
I know. But it's really cool. The procedure itself, I really like. It's probably one of the more complex procedures that you'll do in sim clinic, and there's just a lot to it. And I like the challenge. It's fun.
Yeah.
You got the access, you got the cleansing and shaping of the canals, and then you have to obturate it and everything. And yeah, it's pretty sweet. I like it.
Yeah, we haven't gotten into it too far yet, but
Right.
I can definitely tell, based on just the limited amount that we've had in lecture and lab,
Yeah.
I can see where the challenge would come from, and I can definitely see where people are drawn to endo just because it's tough. With a crown prep, you can see what you're doing. Everything's there.
Right.
Whereas with endo, it's more of going based on feel and your experience, which is definitely.
Yeah, it's almost a guessing game. You really got to rely on your radiographs and everything, and know your working lengths and all that stuff. I won't scar you with that yet, because I know you're already in the midst of that right now. But yeah, it's cool. So what else you got? You got fixed pros, you got endo. What else you doing?
So fixed pros, endo, removable, oral path. We have ortho, so ortho, lecture, and lab. The first time we were bending wires in class, my thumb hurt for 4 days. I feel I don't know if I did something with a nerve, but anytime I would touch something with my thumb, it just hurt.
Right.
And it's been better now. Like, I've actually gotten the hang of it. But the first class we had in ortho, I was just like, oh my gosh, like, how do people do this?
Right.
But I'm assuming most orthodontists probably don't bend their own wires, if I had to guess.
Yeah, unless it's like a emergency situation or something where they need to change. But yeah, I don't know.
Yeah.
I don't know.
Yeah.
Have you done any denture stuff yet? RPD or full dentures yet?
So we actually just, for removable, we just finished polishing our, like, dentures. So I don't know what they have you guys do, but they had us, like, make our own wax rim, like, place
doing
the
that
teeth.
right now.
Yep. Exactly. So wax rim, place the teeth, send it into the lab to have them invest it, and then polish it up.
Awesome.
So I remember being so frustrated with setting the teeth because it, like, looks good, and then you relate it to, you know, the other arch, and it looks like absolute garbage.
Right,
You're
right,
like,
right.
who did this? And it's like, it was me. But yeah, so we just got that done. So we're starting to do a little bit more this semester of, like, partials.
Okay.
We haven't gotten into it too much, but I'm curious to see how it goes, honestly.
Yeah, it's weird. We did RPD and now we're doing complete dentures. So we kind of did opposite of what you guys did. But really, RPD can seem very daunting. Just because of all the components and clasps and, you know, all of these other types of things. But, like, once you learn the theory behind it and, like, the different situations of a denture, whether, like, you'll learn, like, Kennedy class 1, 2, 3, that kind of thing, or 4. You just got to follow the protocol, and it comes naturally. It's just you really got to learn the concepts behind it, and then you're good. So
yeah. No, I was about to ask, like, what'd you think of, like, partials, because, like, obviously I have that coming up.
So I would much rather place an implant if I had no. It depends on what the patient wants. That's the most important thing. But I enjoyed it. It was really cool. Like, pretty much how we were tested on it is we had a whole design exam. So, like, we were put in a room, we were given 2 casts or 1 cast, and we had to fill out a lab prescription of our design and everything, and that's kind of how we were tested on it. But I liked it. Some people struggled with it. Some people found it easy. It kind of depends on who you are. But like I said, it really comes down to, like, the concepts. Like, you haven't gotten into any RPD yet, have you?
Really?
Okay.
We haven't, no.
So there's all these different clasps and different like, configurations depending on where the edentulous sites are. And you just have to know what setup to use in certain situations, and you're fine. And it, you know, it really comes down to also understanding the forces that you put on a tooth. Like, if somebody's edentulous way back in the, you know, the molar region, and they bite down, you know, that kind of tilts the RPD a certain way, so it could put torque on other teeth that is supporting that. So it really what it comes down to is just knowing that concept and being able to visualize that.
That makes sense.
You'll be fine. I mean, it's very concept driven. Is really what I'm trying to say.
And I feel like even so, like, for us when we did, like, the full dentures, it's still the same kind of thing. Like, if you have a patient biting down their molars, you want to make sure that it doesn't tip a certain way.
For sure.
and cause, you know, issues like that. So I'm sure it'll probably be similar if I had to guess.
Right.
Yeah.
Definitely. Yeah. They're very similar concepts. It's just slightly different. But
yeah.
So let me ask you this too, because I ask a lot of my guests this. What made you want to go into dentistry in the first place?
So initially, I was a math and science guy. I knew I was maybe something health field, something engineering. Like, that's what I was between. My friend's dad, who was a dentist, my friend was like, hey, like, my dad's a dentist. You want to just go, like, shadow him, check it out? So I did, and pretty much that was when I was like, all right, I'm sold. Like, where do I sign up? Because it was cool, like, to be able to, like, interact with patients, have the autonomy to be like, hey, I want to have my office like this, or I want to set my stuff up like this. It's just unique, and you really don't see that in many fields at all anymore, let alone healthcare fields. So that's kind of what initially brought me in, and as I've kind of gotten more into it, I've realized, like, it might even be a better situation than I thought it was.
For sure.
Yeah, because, like, once you're actually into the field, you realize, like, there's so many different ways you can take your career. You can work for someone, you can work, like, you can own your office, you can work for a group, or you can be solo. Like, there's so many different ways that you can customize your career, and
100%, yeah.
With big organizations, like, that's just not going to happen.
Right. Yeah, I was in a similar situation. My dad is is I'm a high school math teacher and math and science teacher, so I kind of grew up with that, like, oh, I want to be a doctor of some sort, not quite sure. Wanted to be an orthopedic surgeon, but when I told my doctor that, he started banging his head against the wall, and he's like, don't go into medicine. He's like, surgery's a great career, and I'm not going to stop you, but go check out dentistry first. And of course, I shadowed and fell in love with it. But what I really saw when I shadowed is that, like, dentistry is one of the few careers. Let's just compare this to medicine for a second. Like, if you're a radiologist, you just take the x-rays, right? And you send your patient to the physician. If you're the surgeon, you just do the surgeon, and you send the patient, to another doctor. As a dentist, you do all of that. You are the radiologist, you are the surgeon, you are the primary care physician, and when it comes to, their dental needs. So you get to see that complete transformation.
Yeah, it's like a one-stop shop.
Exactly. Yeah. I like that. It's a lot, there's a lot of variability in it.
Yeah, and that's kind of one thing that's almost, I don't want to say it's shied me away, but almost like steered me away from specializing, just because like I want to be able to kind of provide like a one-stop shop for everyone.
Me too. Yeah.
Whether it's me providing all the care, or whether you have another doctor coming in, once or twice a month to, do surgery or do ortho, whatever it is. Like, just being the place where someone knows, like, hey, if I have a dental issue, this is where I can go, and I'll be able to get everything done.
Right. Yeah, I am in the very similar boat as you. Like, I definitely want to be that dentist that can do, a ton of different things, implants and Invisalign and their own endo as much as I can do without referring out, So, yeah, I totally agree with that.
Yeah, it's great. Like, it's initially I was like, all right, this sounds cool. Like, I wasn't like super enthusiastic about it, but I was like, all right, this is cool. And as I've gotten into it and like gone to, conferences like Voices of Dentistry and the Dental Success Summit, like, everyone is just so cool. And you'd like kind of put these people up on a pedestal of like, oh my gosh, like, it's crazy like how much they've done. But when you get to meet them, they're just another person,
Exactly.
And it's so nice to see like that element of just kind of like individuality and like people it's just people,
Right, yeah. I was kind of talking on my last podcast with David Maloli.
Okay.
Yeah,
absolutely.
And we were talking about a little bit like how Instagram is such a highlight reel, right? And you see all these perfect composites, and you think this dentist is just absolutely perfect all the time. But I love these meetings, right? Because all these people that post or all these people that podcast, like, they're just people too. You know what I mean? And it's really cool to discuss not only the highlights of dentistry, but also like downfalls and issues. Like, we all can relate to that and work together to like improve ourselves.
Yeah, and that's, like you said, like at meetings like this, people aren't afraid to show like, hey, this is what didn't work. This is where I came short. And that's just so refreshing because, like you said, everything on the internet, people are so afraid to put out stuff that makes them look bad or makes it look like they're not a perfect, practitioner, a person, whatever it is.
Right.
So it's just so nice to be able to see that here.
Yeah. And that's really where you learn too. Like, you're not going to learn from doing a perfect implant or a perfect crown. Like, you don't learn anything from that. But when your failures and when things don't go as planned, like, that's where you learn. Like, okay, well, maybe I should have prepped this differently, or okay, I should have designed this crown differently, or whatever it may be. But yeah, that's where you learn. And I love that everybody's so open and honest here, especially a lot of people like Dr. Moody over there that talks about, like, when you take his course Implant Pathway, he talks about those things. It's not like, hey, look at these cases where everything went perfectly. It's more, hey, here are some cases that went wrong, and this is what I should have done, and this is what I want to teach you and show you for when you encounter these things.
Yeah. Learning from your mistakes is huge.
Absolutely.
And I don't feel like there's been a whole lot for me, like, so far, but I mean, it's just a matter of time. Like,
it is. Yeah, and I will say, and this is not to sound bad or anything, but dental school's gone pretty smoothly so far, and it sounds like it's going pretty smoothly for you.
Yeah.
But there's definitely going to be challenges. You're going to hit things that maybe you thought you were just going to destroy, and you come up a little bit short. But that's when your mindset and everything takes over. Like, if you want to be a driven person, like, that's when you get into and take or spend extra hours in the sim clinic, and that's how you overcome those things. That's how you get really good at being a future dentist and overcome those obstacles in dental school. Yeah, absolutely.
Yeah, and it's like, I feel like this is the most generic statement of all time, but like, it's not about like what happens when something goes bad. It's just like what you do about it.
Exactly. Yeah. So cliche, but so true.
Exactly.
Right?
I hate dropping phrases like that, but it's how it is.
You're right. So here's something. What's been your favorite subject in dental school so far? Do you have one?
I honestly would probably say fixed pros, so just like crowns. Like operative was fine for me, like, but it's very like small scale, and especially with the plastic teeth, I feel like if you nick one like little wall of your prep, it's just a mess. So
I know, even when you're doing like a crown prep and you're trying to get through the interproximal, like the slightest touch on it, like that tooth's gone.
Yeah, exactly.
It's not realistic.
But yeah, it's just like when you get a nice crown prep done, like the margin looks good, and it's like satisfying. You know, it's just like a little small version of the tooth that was there before. So
right. Yeah.
That's probably been my favorite. What about you?
Cool. I love fixed pros as well. That was something that kind of came more easily to me. I love composites. I love that kind of artistic side of dentistry too. But what I'm really passionate about, and of course I love all those things, and I'm going to do them in my future practice, but what I really want to do specifically, because it's not that available in our dental school, is implants. Okay, we're taking a course right now, but it's more lecture-based and more on we're going to teach you how to restore implants and not place them. So there is some sort of advanced track our 4th year where we can learn how to read cone beams and actually do the placements. But that's really where I'm enjoying myself a lot right now, is what we're going through, is this implant course. So
yeah, definitely. Yeah, and I feel like with any school, I mean, maybe you'll get a handful if you're lucky, but
yeah, I know
there's really no schools I feel like that are focusing on that, just because.
Well, here's the thing too, just Midwestern Arizona, I mean, they're dropping screws left and right. Mm-hmm. It's unbelievable. And Creighton, those programs are so lucky because they don't have specialties. And I know specialty programs are great and everything, but they suck a lot of procedures away from the undergrads, basically, in school. But I talked to a whole bunch of students from Midwestern Arizona, and they get to offer their patients 2 implants for free. Like, they have 2 implants. I don't know what the time period is, but they have 2 implants that they can offer their patients for free. So, like, if a patient has a edentulous mandible, for example, they can offer them those implant placements for free. The patient will have to pay for the overdenture, but the placement of those for free. So, like, that is such a good deal with the school and this implant company. I think it was like Bicon or something. I haven't really heard of them, but still, like, that gives the patients the care that they deserve, because obviously implants are becoming more and more reliable. But it also gives the students like the experience, which is really cool.
Yeah, that's seriously an incredible opportunity, because I feel like, this is just speaking from my experience, so I don't know if this is the experience everywhere, but generally schools offer discounted dental work to lower income individuals. So lots of times implants going to be out of the question as far as price goes. So if you can offer that to them at a price, free, where it's available for them, then absolutely you get the patient some really good care, and you also give the student the experience of placing the implant. So
right,
that's really cool. I didn't know that was a thing, but
I know it's not very many programs do it, but it's crazy. And I think here's another crazy thing that other schools do. I think it's UK, Kentucky, how they run their kind of pre-clinic is that 1 week they'll learn about it. They'll have a lecture about, let's just say, like a class 2 prep and restoration. The next week they'll be in sim clinic practicing that. And then the following week, what they do is they're in clinic on a real patient. An older student will numb the patient up and take care of that, but then the student actually does the restoration.
No way. That's crazy.
Like their second year.
I can't even imagine that.
I know.
Yeah.
But like, it's such a good, it makes sense, because that student only has to focus on the restoration. They don't have to focus on, numbing the patient up or the medical history or anything. They're just focusing on that. But it's really cool that they get that experience on a live patient.
Yeah, you can like slowly add things, so it's not like all at once. It's like patient interaction, numbing them up, like prep and restoration, just like one thing at a time.
Yeah, I think that's super cool. So, what I'm trying to see what else. What podcasts are you listening to? Are you a big podcast guy?
I would say decent.
Yeah,
decent podcast guy.
Okay, that's what I like to hear.
Yeah, exactly. Yeah, I've listened to Shared Practices all the way through.
Okay.
I mean, I feel like the value that they provide is just on another level.
That's the thing. See, and I feel so bad. I'm such a big podcast listener, but I've never listened to them. So right after this, on my plane ride home, I'm downloading a whole bunch of their episodes.
Absolutely. And it's just the thing that really, really stands out to me about it is that was my first podcast I stumbled upon, and they provide it in like a chronological order.
Right.
So it's kind of like the path to practice ownership.
Yeah, that's cool.
When Richard started the podcast, he didn't really know a whole lot about it either, and he kind of started it out to kind of learn about it himself and help others learn about it. So it was nice that he didn't come in with already a bunch of knowledge. So he was kind of trying to process everything when, his speakers were explaining it. And I was kind of in the same place. Like, it was my first, podcast I listened to about dentistry. So it's just really nice to kind of be on the same level as the person that's doing the podcast.
Yeah, that's really cool. I appreciate that too. So also anybody who's listening, Shared Practices, go check them out. It's a great podcast.
Yeah. Dabbled in Dentalpreneur a little bit.
Yep.
Honestly, other than that, I've definitely listened to a decent amount of Paul Etchison's podcast.
Yeah, he's a
Heroes.
couple tables down. Yeah, I haven't listened to him either.
Yeah.
Got another person I need to listen to.
Super down to earth guy. Like, his leadership advice is like amazing. Like,
Okay.
he has a really nice practice in Chicago. 11 ops. It just runs very efficiently, as far as from what I can tell. And there's a lot of management advice out there, and I feel like just straight numbers advice, but he's kind of more the like intangibles, like how to keep your team happy, how to keep your patients happy, like how to run an office that makes you feel good and makes everyone that's there feel good too. So I've really enjoyed his. I've definitely gotten into that more recently, and I'm glad that I stumbled upon it.
Yeah, absolutely. And really, regardless of what podcast you're listening to, like, you're going to learn something.
Yeah,
you know
absolutely.
What I mean? And everybody offers different kind of areas of expertise, but sometimes it's difficult to keep up with them. Like, I follow so many, like, I'm like, oh, I got to pick and choose, which sucks. But like,
There's so many. Yeah.
I know. And I love Dentist Implants and Worms and Dr. Mark Costas, Dentalpreneur, and the Kentucky boys down there, Life of Dentistry.
They're so funny.
They're
Oh my
awesome.
gosh.
They're great guys. But yeah, it's just so hard sometimes to keep up with all that content. But
Yeah.
Regardless of whatever you listen to, like, it's awesome.
Yeah. And I didn't know about any of this stuff before I was in dental school. I didn't listen to podcasts at all before I got into dental school. And I can't even remember how I stumbled upon it, but I'm so glad that it did. Like, it seriously changed my life.
Yeah, it is. And, it's kind of sad that not all dental students take advantage of it, because podcasting, it's obviously growing, but not everybody knows about it, and it's like, this is free CE, this is free content that you can listen to make yourself a better future dentist or entertain yourself or whatever, really.
Yeah, it's free. You can listen to it whenever you want. Like, it's so flexible and so much information you can learn. It's just,
Yeah.
it's hard to even put in words, honestly.
Right. And it brings people together too. Like, I'm conversation with you right now, like, it's awesome being able to meet all these different people and sharing that common interest of dentistry. So
Yeah, and everyone, kind of like I said before with this meeting, but everyone is so much more humble than you would initially think, honestly. Like, if someone has a podcast that has millions of views, you wouldn't expect them to be approachable and be like, oh yeah, like, I'm super willing to help.
But they are.
They are, exactly. And it's so refreshing. It's awesome.
Right. Because really, at the bottom of it, they're just passionate about talking to people. That's all they want to do is meet people. They don't really care about their downloads or views. Like, they just want to meet people, and all of that kind of is just an indirect result. you know?
And I like, speaking for me, and I'm assuming probably speaking for you and a lot of people here too, about like all this stuff, like about the business of dentistry and about leadership and all that, like, people want to help. Like, if someone comes up to me and asks about any of this stuff, like, I would love to help out with this, because like it's just so nice to like talk about like mutual interests and stuff like that's really gonna affect you down the road. So it's just, a lot of people don't realize how important it is until it's too late.
Absolutely. So more about you. What do you have any plans after? I know your second year. We're only almost halfway done.
Yeah,
but we got a ways to
exactly.
go. But do you see yourself opening a practice, associateship? Like, what are you thinking?
So most likely I would say acquisition. I'm not super sold on the idea of a startup. Like, I don't need to build everything from the ground up. That's just not kind of part of my vision. Ideally, I'd like to end up either in Dallas or somewhere in South Florida.
Beautiful places, both of them.
Exactly. So I can't be too mad about either one of those. I'm definitely not sold on like buying straight out of school. Like, that's not something that I need to do. I know there's some people that do, and I wouldn't be closed off to the idea, but definitely not like hard sold on that. I would say ideally like associateship from maybe 6 months to a year, just to kind of get more confident with my clinical skill.
Exactly. Yep.
Yeah.
I think everybody needs that. They need a little bit of time to, hone their skills, get their speed up a little bit, and get that like vital inside knowledge of how to run a business, how to run a practice. You get to see that with the the main doctor or the owning doctor of the practice. So
Yeah.
I think that's essential.
Yeah. So, I mean, once you do get into practice ownership, the business part of it's new and managing people is new, but the clinical side isn't. So that way, at least there's not as much like new stuff being thrown at you all at once. Yeah. So I would say that's probably my like goal. I'd like to end up in my end goal would definitely like to be a bigger single location practice. So maybe 4 or 5 docs running out of a single office, you know, maybe 15 chairs or maybe even more. I just feel like it'd just be nice to have everything in one location. I know the multi-practice thing definitely comes up quite a bit, but being able to be that heavily embedded in like one location and one kind of community would be a pretty cool thing.
Yeah,
So
absolutely.
that would probably be my end goal. But you know, as you know, we'll see where it goes.
Exactly. Anything can change.
Yeah.
Okay, so more, that's kind of in the future, more a pressing issue. When do you guys start seeing patients?
So for us, we start seeing patients somewhere in between D2 and D3.
Okay, so this summer is when
Yep.
you're, okay, same
Yeah.
with us.
Okay.
What are your thoughts? Are you nervous, excited?
I don't know. I mean, it'll be interesting. I'm sure the first couple times will just be weird.
Yeah, it will.
Putting your hands in someone else's mouth is just like a weird concept that I'm sure fades quite quickly. You know, you just get used to it. But I mean, I'm excited. Like, because this, I feel like D1 year, you get a lot of the just generic sciences where it feels like super far off from actual dentistry. And as you progress through school, you start getting more towards like, okay, this is more and more applicable. And by the time you're seeing patients, you're like, all right, like, this is it. This is kind of what my past 2 years have been building up to. So I'm excited. Like, I'm sure I'll be nervous when the day comes, but for now, you know, I'm pumped to see what the future holds.
Yeah, I feel similar. I just feel like the first time I have to do a prep on somebody, like my hands are gonna be shaking, man. You know, and obviously, like you said, we'll get over it. But that first couple times, you know, it's a little scary, you know, doing that
Yeah.
for the first time. But are you guys doing rotations now? I'm assuming.
So we did. It's really weird. So like I was talking about with kind of the new curriculum being integrated.
Okay.
I feel like not everything is going as smoothly as we hoped. We just opened a new clinical building this semester, so it opened, you know, no more than a couple weeks ago. So there's still quite a few hiccups with that. Like I know the first couple days that the building was supposed to be open seeing patients, they didn't have any suction. So
that's a
so
problem.
obviously you can't see patients with no suction. So I think things are slowly getting worked out over there, but we actually don't have any rotations over in the clinic right now.
Really? Okay.
We had them first year where we just kind of go and assist or shadow some older students, but yeah, this semester we don't really have a lot of
Interesting.
that. So
Okay.
definitely interesting.
Yeah, so you're just gonna get thrown right into it, really,
Exactly.
basically.
Yeah. I'm assuming. Do you guys have rotations right now?
Yeah, so we had a set of rotations last semester. This semester, we have a rotation through our oral surgery department where we're assisting with extractions. We have one in our PG perio, so we get to see some cool flap surgeries or grafting or implants or whatever. PG endo, we have one where we get to see some root canals and stuff. And then we also have rotations through, our radiology department, so taking x-rays and stuff. But then we have a set of rotations that is through our clinics. Like, our school has separate, I think we have 5 separate clinics within our school that students are assigned to.
Okay.
So we get maybe 5, 6, 7 times throughout the semester we'll go in and assist within that clinic that we are assigned to next year.
Okay.
So that way, we get to meet the attending dentist or the overseeing managing dentist of that clinic, and just kind of get experience and kind of understand how everything works, or get a better understanding of how things work.
Do you guys have assistants? Like, do you guys have people
We don't.
assisting you?
Nope.
Oh, man.
I know. Do you guys?
So it just changed. So you get put in a group. So you have a D1, a D2, a D3, and a D4.
Okay.
And so whenever you're in clinic, like let's say if you're a D3, you'll have your D4 in your group assisting you that day. And if D4 has something, you'll have the D3 assisting you.
Got it. That's kind of nice.
Yeah,
And
it's awesome.
And I've been talking with a lot of different people talking about how nice it would be, regardless if it's a dental hygiene student or maybe an older dental student. Like, it's nice to have an assistant there so you can, I don't know, just understand how to work with an assistant.
Yeah.
Because, you're on your own a lot of times. We're on our own, and I wish we had at least something like an ISO dry or something like that.
Do you guys not have that either?
No.
Oh my gosh, dude.
So
They're leaving you out to dry.
Yeah,
Oh
so
my gosh.
we just have to put our suction in and really bend it around so it just kind of hangs in.
Do you guys ever have the patient hold on to it, if it doesn't stick, or most of the time it works?
I'm sure. I mean, yeah, I don't really know. I mean,
Yeah, I guess that's true.
it depends on the patient and the
Yeah.
situation, but I could definitely see that happening,
gosh,
which is a bit of a bummer. But I guess, I mean, when we get out, we'll appreciate our assistance and ISO dries a little bit more. But,
it's just like, because obviously when you're out, you're gonna have an assistant. It'd be nice to kind of get used to that while you're in school.
Exactly.
And obviously, if you're working by yourself, like, you're just gonna be really slow. Like, there's just no way around it.
Yeah,
And, like, students are already slow as it is. You don't need to make it worse by not having an assistant either.
No, I agree. So like that's why like I really want to try to practice as hard as I can this semester. So like I'm pretty quick with my patients.
Yeah.
But like even so, like the first couple patients, like a crown prep's gonna take that entire 3-hour appointment.
It's just
You know what I
different,
mean?
you know?
Yeah,
Like, you got the water spraying everywhere. You can't see anything on the mirror. You're like, all right, what's going on here?
Yeah, you're spraying your patient with water, you know.
Or yourself even.
Oh yeah, that's happened to me too. You know, and I'm doing number 8 in a crown prep, and I just like angle the handpiece up,
like,
and I just get
whoops.
shot right in the face. Yeah,
Yeah,
with
exactly.
water. But yeah, all a learning experience. So,
Of course.
Yeah, absolutely. Well, I think that's it. I think we're gonna start wrapping it up here. Thanks for sharing what Texas A&M is like. It sounds like you guys have a good program over there, and that you're enjoying it, and that you got a plan after graduation.
Yeah, fingers crossed that it stays true. But with anything, it's subject to change.
Awesome. Well, I'm glad everything's going well for you.
Yeah, seriously.
Thanks for being on the podcast.
Same here. Thanks for having me.
Absolutely.
It's nice to finally meet you in person. I feel like I've seen you so many times, like online. Like it's like this Brandon guy, he's around. But nice to finally meet you.
Well, thanks. I appreciate that. It's nice to finally meet you because I've seen your name too on Dental Student Success Network and everything, and it's nice to put the name with the face and voice now.
Exactly.
Right.
Exactly.
All right. Well, Payton, thanks so much for being on the show. We'll talk to you soon.
Bye.
Take care.